Meet our son Eric. He is a sweet and silly boy with unlimited curiosity and a mind like an engineer. He loves things that spin, trucks of all kinds, and he especially loves playing with his older brother Bo. When Eric was a newborn, a hearing test discovered a slight problem with his hearing that eventually progressed to profound bilateral sensorineural hearing loss when he was 1 year old. That's the medical way of saying Eric is deaf.
Around 2 years old, Eric had cochlear implant surgery to help him hear with technology. We call these his ears. A cochlear implant works by turning sound into electrical signals and directly stimulating the hearing nerve to the brain. Eric's cochlear implant is powered by a rechargeable battery and sits near his ear. At the top is a microphone that captures sounds in the environment and sends that information to the circular transmitter, or coil, on his head. The coil is held on by a magnet and connects to an internal device that sends sound information into the ear and brain. Eric is doing well with his cochlear implants, and he should be able to develop normal language and speech. But, while remarkable, this technology is not the same as having normal hearing. For one, if the batteries die, or if the coils are off, Eric can't hear anything. After all, he's still deaf. Secondly, the sound from a cochlear implant is very different. Here's an example of what Eric hears.
One cold rainy day when my father was a little boy, he met an old alley cat on the street. The cat was very drippy and uncomfortable, so my father said, "Wouldn't you like to come home?"
This is only a simulation. Fortunately, Eric's brain can learn to make more sense of this than we can. Many cochlear implant users report that with consistent use, fine-tuning, and ongoing therapy, their perception of sound becomes much more natural over time.
Eric is as capable as any of his peers, but there are a few things you can do to help make communication easier. Number 1, talk to Eric a lot. Narrating what you're doing, or even what Eric is doing, is a simple way to bring more language into common activities. Ask Eric lots of open-ended questions and give him a little extra time to answer, about 8 seconds. Using a variety of words will help grow Eric's vocabulary, language, and listening skills. Number 2, get Eric's attention before telling him something. Otherwise, he may miss the first part of what you're saying. Plus, if Eric is already looking at you when you start speaking, he can use context like facial cues and lip movement to help fill in any gaps. And speaking of, it's also best not to cover your mouth or block your face when speaking to Eric. A clear, projected, and directed voice will be easiest for him to understand. Number 3, reduce background noise. It's easiest for Eric to listen when there is no background noise from electronics, appliances, or other people talking. Whenever possible, you can help by reducing noise in the room or finding a quieter area to talk. You can also help by moving closer to Eric when you're talking. Within 3 feet is ideal.
Thank you for listening to Eric's story, learning about his cochlear implants, and considering a few tips to help make communication with him easy. As a typically hearing family, we've learned a lot about the deaf and hard of hearing world that we love to share. And we're fascinated by the technology that allows Eric to hear speech and sounds, so we welcome curiosity and invite you to ask more questions should you ever have any.